There. We are live now.
Yeah, now you're
Hey,
done.
now we're live. Let's go. All right. Welcome, everybody. This is our first UroFill live of the year. My name is Dr. Alfie Suarez-Sarmiento Jr., and I'll be your moderator today for the discussion. We have a really exciting day. We have a conversation lined up with two of our incredible experts in the field, Dr. Paul Perito, the inventor of the UroFill technique from Perito Urology, and Dr. Clay Williams of Elite Enhancement of East Texas, Tyler, Dallas area. Thank you, Dr. Williams, Dr. Perito, for being with us here today. But just to give a little, before I let these guys talk, just to give a little introduction, Dr. Perito was the founder of Perito Urology and a pioneer in this space when it comes to cosmetics and implants. And Dr. Williams, the same thing. He's been our provider now for about 2 or 3 years, but he's got plenty of experience, 10, 15 years in urology. But today, it's not about the science. We're diving into real patient success stories with the UroFill technique. For those of you who may be new here, UroFill is the first and only patented penile girth enhancement technique using hyaluronic acid. It's safe, it's minimally invasive, and it's performed exclusively by urologists who are certified by us at UroFill. So we've been trained to deliver this. We have over now 11 years of data and going. But beyond the technical side, what makes UroFill truly special is the impact that it's having on men's confidence, their relationships, overall well-being, and well-being, sharing some amazing patient journeys and how they got here, because every patient is different. Urofil is not one size fits all. It's for every man. The man that has a little bit wants a little bit more, the guy that maybe has something that was bothering him aesthetically. So today we're here to answer it all, so make sure to drop your questions in the chat and I'll try to get as many as possible. But let's get started with Dr. Preto and Dr. Williams. Thank you guys again for being here to kick things off for our first UroFill Live of the year. Florida and Texas, it's a nice cross country thing. But I wanted to start with some icebreakers. Dr. Perito, what inspired you to get into male cosmetics, especially general cosmetics?
Well, after maybe 25, 24 years of doing penile implants, you learn one thing, that men focus specifically on length and girth. You give them back their function, and you would think that they're happy, but they're unhappy because if you have erectile dysfunction, you're losing length and girth, and it's a realm that was really not entered into by those of us that are experts in the field of the penis itself. So it was probably about 12, 13 years ago, we started experimenting with certain modalities. I tried some of the stuff that was out there in the Ethernet, and nothing was favorable. But then we moved into the use of hyaluronic acid. Then we just applied everything I've learned from doing penile implants to doing penile girth enhancement with hyaluronic acid, and it's transformative for my practice, for my patients, for my implant patients, for a whole new realm of patients, which we'll go over in a little bit, because this is something that has been completely neglected by our societies, our colleagues, and our colleagues and our societies now. They're all on board, totally on board, to take care of male genital cosmetics.
And then Dr. Williams, the same question to you. What interested you in this field?
I'll try to keep this short, but that's it's very interesting. You know, I think Paul, the first time I came down to do training with your minimally invasive penile prosthesis was 2018, and I've been back countless times. Miami's a good time, but I actually did want to do some good training down there, and I've always told you easy cases and bring on the the redos, and I don't know, maybe the fourth or fifth time I came down there, you took me into the room and I expecting to see a post or pre-op implant, and there's a tray full of needles, and you started doing girth enhancement, and I was like, what the hell? I was like, what are you doing? And you explained it to me, and I don't even know where to begin. I remember came back and told my wife. She's like, what? I was like, I'm not joking. So it's some other SMS, we had some cocktails and we were talking about it again. I said, well, I'm still interested, but yeah, I don't know how to do it, because I do urology with the University of Texas with 5 of the guys, and I couldn't figure out how that was going to work. Not being in private practice anymore. My wife said, well, maybe we should start our own business and do what we know to do, the marketing, and you do what you know to do. You're an expert in male reconstructive surgery. So we kind of had to wait till our oldest child, our daughter, was a senior in high school. We weren't quite empty nesters, but as you know, when your kids getting high, senior, you might as well be empty nester. They're not around anyhow. And she said, you should contact Alfie and Paul, and we should go down there and really, we should start the company and start this. And so, we came down there, trained with y'all, the marketing, the technique, just, hours upon hours of training and really getting into it. And it was just mind boggling because, on a day-to-day basis, urologists, we do reconstructive surgery, male, female, we do kidney cancer, prostate cancer, kidney stones, and that's all rewarding surgery. Don't get me wrong. The patient's happy, we're happy, but, and it's been a bit beneficial, but at some point, some of the rigors of what we do medically and surgically, it takes its toll mentally, physically, spiritually, emotionally. And what excited me about, girth enhancement with UroFill was it was something that was reproducible, safe, efficacious, and at the end of the procedure, everyone's happy. Not that it's not happy to cure someone's prostate cancer, but I mean, let's think about it. This is, 20, 30-minute procedure and give or take. And the guy walks out and he looks out and he's like, dang, I mean, he's got girth right then. And so, no side effects, very little risk, if any. And that's what really sold me, was that these guys, like you said, Paul, the day we wake up, in the morning, or the day we're born, we look down and that is the only thing we're fixated on is our penis. And so to do something like this for these men that has no risk and is just cosmetically beautiful, functionally, everyone's excited with, no risk. It was just it balanced the life of urology for me, of something very satisfying and gratifying very quickly to both, me and the client. So that's kind of what sold me on it.
Just real quick, where he's going, I'm giving a lecture this weekend to all the top implanters in the world. And, where you're going with that is dealing with pathology we're accustomed to, dealing with vanity we're not. And when you deal with it appropriately, and you have the skill set of a board certified urologist who specializes in reconstruction and andrology, it's a game changer for your patients and for yourself. So
Yeah.
and I'm glad that you and your wife, yeah, and you guys can come back anytime. Miami is a good place to visit.
No,
Oh, yeah.
I get you, brother. I get you.
no, and that's great to hear. Really the message about UroFill all along was that we want to be the stewards of the penis. Nowadays, marketing, internet, social media, there's a million different ways where essentially men of this world are being duped or preyed upon for reasons of grandeur or what have you. So, we really want to be on our soapbox here and show what is the best way, and by staging and by all these different techniques. But, Dr. Perito, what kind of patients might UroFill be for? Who might have benefited from this?
So Clay already touched on, the vanity project, which if you look at men, you take a million men, right? At least 25% of them would like to see more on their penis, whether it's length or girth, and whether it's resting length or girth. Let me make that resting length. And these are things that can be done. And so that would be your biggest population of patients, which are that 25% of all men across the globe that would want to have just a little bit more. Then you have the subset of men that have some pathology. Maybe they've had a penile implant and their penis is too ovoid and they want to have the more rounded out appearance. Maybe they have Peyronie's, they want to fill in a defect. Maybe they have premature ejaculation. There's all kinds of uses for hyaluronic acid, and because we're board certified urologists, it just opens up an enormous group of patients that need service. And I've known that my implant patients have needed service from the get go, because that was the common complaint. But that complaint is it's not a pathology. It's a normal anxiety that men have, and they might have a perfectly normal penis. And how often, Alfie, do people come in? They got a enormous penis, and they still want more. And
Exactly.
they're not dysmorphic. They just, why not? If you can do it, you can do it safely. Why not do it? And why not do it with a reproducible technique?
Now, Dr. Williams, I want to talk a little about maybe real life transformations. I mean, have you ever encountered any cases where UroFill significantly improved the patient's confidence or maybe brought a relationship back together?
Oh man, I could probably bring up countless stories, and I'm sure y'all could too. Um, you know, you know, we keep going around on this. One is just overall confidence. The shower room or the locker room confidence. That you're going to have your pants down or something. Um, I've had a guy before who was at a country club, and he was taking a leak, and his buddy came up next to him to take a leak, and he was just, I guess he kind of glanced aside. He's like, "Oh my God!" And he goes, "What?" He goes, "Dude, I did not know you were packing that hard." He goes, "Yeah, man." But one thing is that obviously it didn't look abnormal. I mean, he had an enlarged penis, but it looked natural, and so he couldn't tell that this guy, his friend, was not born with it. So the confidence level is really cool. The other thing we hear about, Michelle and I, is anatomy. As guys get older, we lose girth and length. There's atrophy, but due to women having vaginal deliveries, due to the lack of hormones in women, there's an anatomical, there's a physical mismatch between the penis and vagina where they don't match up anymore. And so we have a lot of guys who they admit that, and there are significant others do too, that they don't match up. And so they want the girth so that there's a better contact inside the vagina. We hear that all the time. Emotionally, guys that are, divorced, widowed, they're back on the market. We see a lot of that, and those guys are very happy. And then, you always get the guys as, just normal erectile dysfunction. They lose girth and over the years. And so you work on their erectile dysfunction with medicine, Viagra, Cialis, something, but they need to get back the girth they lost, in their 20s and 30s. Two particular instances, though. We had a very sweet man a couple months ago. He had bladder cancer, and he had to undergo a radical cystoprostectomy, which is removing the bladder and the prostate, everything around it, and you have to get a conduit on the side, and not a colostomy for your feces, but for the urine, put a bag, and the nerves and the blood vessels to the penis are damaged, and he and his wife had been very sexually active, and I've got his erections back going with injection therapy and with Viagra and Cialis too, but he lost girth. And when Michelle and I did girth enhancement on him, the smile on he and his wife's face, they got the erections back. Now he's getting back to girth, and it's heartfelt. And then we have a big Medicare population here, and we get the granddads. The granddads and grandmas. They've given their kids money. They've spoiled their grandkids. Rotten. They have money. They're like, forget it. I want the wrinkles out of my penis. I want a smooth looking penis. And me and my wife here, we may be grandparents, but we want to spice up the love life. And we see that all the time here in Texas. It's hilarious. It's awesome, man.
That, you remember this one, Alfie? There's a funny vignette where a guy's describing he's on his third round, so he's already gotten busy with his partner, and he's describing, because right now we're in the process of putting together the data on how partners respond to this, what you were alluding to before. And if you were to say anecdotally, partners are thrilled, just thrilled. They're not even embarrassed about it. But I remember this one fella saying that after his second or third round, he was like, I was making love to my partner, and she said, "Oh my God." And he goes, "Now I know what it's like to have a big dick." Is that That just cracked me up. That was a classic line.
Oh
Which,
shit.
I'm sure he was fine before, but he just, he made himself very present that day.